Phones have been muted at entry, and you will be able to unmute them during the discussion portion. During the presentation, if you have any technical difficulties or questions about the topic, please use the chat box. This webinar is being recorded and will be available for viewing at a later time on the MHTTC website. To reach us after the webinar, you can email newengland@mhttcnetwork.org. Next slide, please. This slide provides a description of our disclaimers for MHTTC. Next slide, please. The MHTTC network uses affirming, respectful, and recovery-oriented language in all activities. That language is strengths-based and hopeful, inclusive and accepting of our diverse cultures, genders, perspectives, and experiences, healing-centered, trauma-responsive, inviting to individuals participating in their own journeys, person-first and free of labels, non-judgmental and avoiding assumptions, respectful, clear, and understandable, consistent with our actions, policies, and products. With that, it's my pleasure to hand it over to Dr. Raquel Meshullam-Gately for introductions.
Thanks, Courtney, and good afternoon, everyone, and thanks for joining us today. As Courtney mentioned, my name is Raquel Meshullam-Gately. I am a psychologist from Beth Israel Deaconess Medical Center in Boston and the co-director of the Beth Israel Deaconess site for the New England MHTTC. I would like to welcome you to today's webinar, which is part of an important series of initiatives we've launched through the New England MHTTC to help support the well-being of all members of the healthcare workforce experiencing an increase in stress-related psychological difficulties resulting from the COVID-19 pandemic. Now, after almost 2 years of working within this crisis and managing the same types of personal challenges we all have, healthcare workers are experiencing higher levels of stress, vicarious trauma, anxiety, depression, substance abuse, and burnout. Several approaches are available to mitigate as well as prevent these consequences. These include a variety of mental health self-care approaches, some of which we've already addressed through our webinar series, such as mindfulness, yoga, music, positivity, art, and acceptance and commitment-based practices, and some which are upcoming, including meditation and spirituality. We'll be regularly updating these initiatives on our website, and we'd welcome any suggestions for other resources that we can provide. So to that end, I am delighted to welcome my colleague, Dr. Tony Cunningham, to address this important topic with a focus on sleep. As I'm sure you're all well aware, many people are reporting significant changes in sleep during the pandemic. Dr. Cunningham initially presented on this topic for the MHTTC in May of 2020. He'll now build on that presentation by presenting some of the early findings from his longitudinal study, focusing on how sleep affects mood. He'll also review approaches for improving sleep and thereby mental health. So just a very brief introduction for Dr. Cunningham, who is a postdoctoral research fellow at Beth Israel Deaconess Medical Center and Harvard Medical School and Boston College. His primary research focus is understanding the role of sleep and sleep loss in emotion and memory processing, and how knowledge of these systems can be applied to clinical populations and the development of new therapeutic treatments. His goal is to understand changes in underlying brain networks responsible for emotional processing following sleep loss and translate this knowledge into effective clinical interventions. So, without further ado, welcome Dr. Cunningham for joining us today to speak about the link between sleep and mood, improving sleep and mental health during the COVID-19 pandemic. Tony?
I got it. Thank you, Cal and Courtney, for having me. 2 years in and about to learn when I'm muted and not. All right, so thanks for having me. I'm super happy to talk about this topic today. If I get stalled, I'll try not to block my dog in the background of my camera view too much if you want to keep an eye on her instead. But One thing I wanted to point out right here on the front slide is I'm going to try to do some interactive poll everywhere things in the beginning here. So if you haven't gotten a chance to yet, that's why I came back to this front page. If you can go to pollev.com/TonyC360, or if you want to try to get out and do this on your phone, you can just scan this QR code. I'll talk slowly for about 10 more seconds before I move ahead. These will be on future slides as well, but I just wanted to give everyone a chance to potentially log in now to kind of expedite the process when we get to those slides. So that'll be coming up shortly. So you can go either to this website or scan this QR code and you should be all set to hopefully participate. We'll see if it works. It's always kind of 50-50 on those. All right, and then also before I get started too far, I want to point out that all the data that I'm going to talk about today when it's relevant to my study is up and openly available for everybody. That was a big point. We did not just want this data to sit in our not file cabinets anymore, but our web servers and hard drives collecting dust. So if there's anything that catches your interest, or if you have any colleagues or collaborators that might have an idea that they could use this data for, we highly encourage it. We would be thrilled to have you, and I'm definitely happy to help you guys kind of figure out how to navigate it. So this is a data descriptor that we published in Scientific Data that just talks a little bit about the data that was collected up through end of summer last year, and we've continued to collect data, as I'll talk about, until about a week ago. And again, you can go to this link here or scan this QR code and it'll take you right there, or you can email me with questions. But here's a quick look at today's outline. It is pretty jam-packed, but I'll try to move quickly. You might skip a few things here or there, make sure I hit on all topics. But the first thing I want to talk about is just what was our personal experience. I think one of the most important things when I talk about sleep during the pandemic, I mean, we're still living it. It's still going on. We're still being impacted on a daily basis. My slides were a little late being turned in because my daughter had a COVID exposure and childcare got all topsy-turvy for about a week until she got tested, came back negative yesterday, fortunately. So I wanted to touch base a little bit about your personal experience with sleep. Then I'm going to, again, for context, put things back into what things were like in early mid-March, late February 2020, just to help us remember what it was like. And I think that helps make sense of some of the data I'll present you. Then we'll talk to you guys about the study that we had going, the Boston College COVID-19 Sleep and Wellbeing Study that I did present, like Raquel said, in May of last year. I presented, like, this is the study that we have up and running. I hope to be back with some results soon, and here I am. And I would say this is a part 2, and that's why I put initial sleep results and initial affect results. I'm hoping this is a part 2 of maybe 3 presentations on this as we literally just finished our data collection that we're currently planning last Friday. So we have a bunch more data that it's not even been processed and looked at yet. So we'll be able to look at even more. And then at the end, I'll make sure I get to this. If we're short on time, I'll jump ahead and I'll talk about what are ways that you should focus on improving sleep, even in the midst of the pandemic. All right, but to get started, we're the first things first. Let's see if this works. Again, you can go to this poll everywhere, pollev.com/TonyC360, or scan this QR code, hopefully. And what I want to know is, in the early months of the COVID-19 pandemic, how did your average sleep duration change? Is that working? People getting that question or no? No, that's sure enough. I feel like this might have happened before. Let's try this one. This one's asking about sleep schedule consistency. This one I didn't see the thing. I guess the problem was
it would ask that you start it live, since it is still just for you privately. Once you make it live, we will all be able to see.
Interesting. Okay. Give me 1 second here. Apologize. I updated the question slightly, and that must have turned off the functionality. Oh, I think you know what? I think I know what it's happening. I'm using a different computer, and I don't actually think I have Pull Everywhere downloaded on this computer. Okay, so we'll just proceed to not take up too much time figuring this out. But what I do want you to do, you don't have to, maybe you guys can put it in the chat. I apologize, I was hoping to be a little bit more interactive. You can think about during the early months of the COVID-19 pandemic, how did your average sleep duration change on average? So just think to yourself, it's okay, you don't need to respond or anything like that. But were you sleeping more than pre-pandemic? Were you sleeping less than pre-pandemic? Did you not really notice a change in your sleep? Or was your sleep amount kind of all over the place at the start of the pandemic, which is definitely the case for some people? In the next question, I don't know why the responses aren't even showing up on this one, but how did your sleep schedule consistency change? And there was 3 options for this one. Did your sleep schedule consistency become more consistent, less consistent, or was your sleep consistency all over the place, based compared to pre-pandemic? In the early months of the COVID-19 pandemic, how did your average morning rise time change? So did you start waking up later than you did pre-pandemic? Did you start waking up earlier than you did pre-pandemic? Or did you wake up about the same time? Or was your wake time about all over the place compared to or during the start of the pandemic? So these are some ideas, again, that we were kind of trying to measure and test. And so I was hoping to get some responses to be able to relate to as we go through this. And then another question I think is really important for the context of the pandemic or of the presentation is, what types of activities were you engaging in, to cope and pass the time during the early months of COVID-19 pandemic? So just take a second and think about, what were you doing during the, there's certainly like some Zoom meetings happening, but I mean, for a while there, like, the world shut down and we couldn't really go anywhere. So, I know a lot of Netflix, a lot of streaming, a lot of things came online. And the point that I'd hope to make with this slide is that, there were still certainly activities people could do. There's a lot of bread baking, if you remember, and social media and things of that nature. So there's certainly like coping activities and coping mechanisms that do work, that are effective for some people. But there was a lot of stuff that got shut down, like shopping or hanging out with friends or going out to dinner, like for a good amount of time. A lot of these things that typically might benefit our mental health were not available to us in the early months of the pandemic. And even now we're still not. My local gym still hasn't fully opened back up. And so, there's still things that are continuing to impact us. And then the last thing is to think about, okay, as we begin to return to normal, how is your sleep schedule consistency began to change? And I obviously put return to normal in quotes. We're still far away and things will never be completely normal again. But, as we as the world has opened back up, as our calendars have started to fill again, how has your sleep consistency especially started to change? So is your sleep schedule now less consistent than early pandemic? Is your sleep schedule now more consistent than early pandemic? Or is it about the same consistent compared to the early days of the pandemic? And so it's, again, just thinking about, are you going to bed and waking up regularly at these different times? So hopefully that helped put in context for you individually. It would have been nice to obviously see it as a group. I do apologize for that technical difficulty. All right, so again, so that's kind of putting it into context for us personally. And so now let's think about what was going on kind of more on a national scale. So we'll think a little bit about what happened, what was going on during those early days of the pandemic, in February and March of 2020. So we'll think back to then. And so what I did is I went back and kind of dug up some old front page headlines from the New York Times. And again, so obviously this is the US edition and things might be different depending on what countries you're from. And this was one of the first headlines. It wasn't even like a major, like the major one, but the first kind of mentions on the front page of this coronavirus crackdown. So that was on Valentine's Day, February 14th, 2020. First time it kind of really started to seep into the front page headline as far as the US news goes. Then February 21st, it's completely off. So a week goes by, not making enough waves for it to make the front page of New York Times that day. Another week goes by, and clearly things have gone downhill since then. So by the end of February, coronavirus fears have driven down the stock market for the 6th day in a row. Some very unhappy traders here. Obviously, some other headlines that we probably don't feel the need to relive anytime soon as well. Here, the airlines are hit by March 6th. So this is another week later, and the airlines are the ones getting hit really hard. And by the 13th, Congress is not only talking about stimulus deal, but it has not completely covered the front page. All of the major news stories by March 13th have now trended towards COVID and its impact on us and the response that is underway at the time. So this is about the time, March 13th, I remember that day, I was okay, maybe this is gonna be a bit of a big deal. So I emailed my my supervisor, Dr. Elizabeth Hensinger, on March 13th, and I was like, okay, maybe we should start collecting some data. Seems like we're trending towards an area where things might shut down for a little bit. Certainly there's some stress in the air. Maybe we can touch on how things, how mood and things of that nature. And obviously I was very interested in sleep. And so the kind of relationship with how people are sleeping and things of that nature. And our thought was like, okay, we'll get this under control pretty quickly, right? So, collect data for a few weeks, maybe a month tops, right? And like I said, we just ended data collection, at least on the main portion of the study, about 5 days ago, about 20 months later. So so 1 week later, we did receive IRB approval and launched our study on March 20th, 2020. And I go through all this to point this out because then it was the very next day. So on March 21st, 2020, that California issued the first lockdown in the contiguous United States. And at that point, 1 in 5 Americans were ordered to stay home in this coronavirus crackdown. And so New York, California, and Illinois all issued their initial lockdowns the day after we started data collection. And our study is one of the earliest ones to start a targeted study towards the impacts of COVID on mental health and sleep. There's a lot of other studies that came online after, and the studies that I think are very high quality are the ones that happened to be going on beforehand and kind of were able to collect data all through this. But those are proven so far to be very small number of those, few and far between. So this is what our data collection has looked at like to this point. And it's kind of been crazy to me that this is now such a small line, because every day for 60 days, I was sending like 1,000+ participant emails by hand to get to arrive in a certain time in their time zone for daily survey assessment. So our enrollment is technically, I guess, probably officially closed now, but we were collecting data every day for 60 days to get a look at kind of during these early days of the pandemic impacts, and I'll show you guys these what variables exactly, but impacts on things like mood and sleep, depression symptoms, activity, and things like that. And then during this period, this white dotted period, we switched to like twice a week for another 30+ days. So we got a really good look at during this early period, this early window of the pandemic during this March to June period of how things were going. And then we kind of initiated these 2-week bumps of data collection on multiple more occasions in which we did these daily survey assessments again for 2-week spans, just to try to see how things were going. So this was, later, this was towards the end of September and early October. And then we did this one to particularly overlap with the 2020 US election here. And then again, we did a couple more, late February, and then we wanted to overlap here with about the launch of our study. So we did another batch here. And then we just finished off another 2-week batch that ended mid-November again. And then at the same time that we did these kind of long, regular daily assessments and kind of these regular bursts of data collection, we also launched these huge one-time assessments. And there were some measures that came up a lot through these, but these, we were looking at questions like, maybe 30 to 50 questions a day, and these assessments would have like 300 questions and a lot of more trait level measures. And so we have just a really rich data set on the participants. Only a small number of our participants completed everything, but we have a lot of data on a lot of people is essentially the point. And we actually just finished, finally shut off this last one, which is our round 8 assessment. It started data collection on October 28th, and we ended data collection on that one. We finally turned it off on December 3rd. So that is essentially the end of our data collection period there. So this was all the data I collected. Again, I'm not going to go through each one of these in detail, but maybe as I'm talking, you people that might be interested can take a look and see some of these assessments that they might be interested in or might have colleagues that are interested in. So these were what was comprised in those big one-time assessments. But what I will go over in a little bit more detail are these daily surveys. So what was I sending out on a daily basis during those 2-week bursts of data collection? So for each one of those, we were doing sleep logs that we got some really good information about that we were able to detail actually like how long were people taking to fall asleep and things of that nature, time in bed, rise time, things of that nature, awakenings throughout the night. We got dream reports, and we finally are getting some progress, and people are interested in working with some of our dream report data. So if anybody's interested in that, that'd be great. We collected data on naps, activity or steps, contacts with other people, virtual socialization. Unfortunately, did not think to do in-person socialization again because we didn't think that we would be going this long. We didn't think that we'd get back to in-person socializing and still be collecting data, but obviously, we found a way to do that. We collected data on exercise, alcohol consumption, overall stress, and COVID symptoms and diagnosis. And for every one of those initial 90 days and every day in those 2-week bins, we collected all of this data. Then we would occasionally do these full daily surveys that included all of these questions, plus the positive and negative affect schedule or the PANAS, the patient health questionnaire 8. So it's the PHQ-9, but our IRB requested us not to use the suicidality question for liability purposes. And then also these questions that we designed that were specifically looking at COVID-19 words. And so those were the questions that we were collecting data on. So that was all the data we collected on. We ended up with over 2,000 consent forms submitted, and we had representation from 60 countries across 6 continents, to not quite break into Antarctica, unfortunately. We had crossed 20 different time zones and had data from 47 US states, Washington, D.C., and Puerto Rico. We did not get data from either the Dakotas or West Virginia. So tough states to crack into this. Looking at how, as far as demographics go, we had some real successes and failures, if I'm being frank about it. And so, overall, of those 2,000 plus consent forms, we would have what I would say were 1,660 active participants that at least gave us enough data to be useful for like any purpose whatsoever. And we still have currently, shockingly, about 1,500 participants still enrolled. Again, not all of them are completing everything I send out, but it's nice to still have them looped into the study. Despite us trying to get a more international sample, I'd say one of the failures is it was still highly US-based sample, so about 81% coming from the US and about 18% outside the US. Well, I'd say one of the successes is that we were able to get a pretty good sample of members from the LGBT group community. So some good representation from sexual gender minority groups there. As far as sex goes and gender goes, though, highly skewed female and highly skewed cisgender. So again, we are, those are some of the failures in getting a more diverse sample there. But again, one of our successes was that we had a pretty high proportion of parents. So we were able to look at things with parenting. The employment was about what we would have expected, 77% employed. and 25% unemployed or retired. And then again, highly skewed white. So that's again, as far as diversity goes. So you're gonna have to keep all these things in mind when I start going over some of our data, is that our sample is a fairly homogeneous white US-based women as the primary sample that we're gonna be talking about here. And it's really interesting, we're not in sync for ethnicities, we're piling mostly not Hispanic. And it's really interesting, it seems to be a trend in these kind of larger studies that try to get up, in which, it just seems like female citizens tend to be better citizens in signing up for these types of studies, especially when there wasn't big compensation involved. And so I think that they are probably the most, females in general are going to be the most studied group during this period, for whatever reason. I'm sure that'd be a great socialist study at some point. Excuse me. All right, so now, like I said, we'll talk to you a little bit about our initial sleep results. And certainly, like, the headlines were rampant, right? Like, sleep troubles were all over the place. They started coming up with new names like COVID-somnia or coronasomnia. You were hearing a lot about it. And so, the big thing was, like, how much credence did it, because it certainly made sense. And obviously, that's why we kicked off the study. We were expecting to see a lot of issues. And so this next slide is actually from my past study, because our whole thought was, well, there really does seem to be two different ways that this can go. Sleeping during the COVID-19 really does seem to be a tale of two cities, where a lot of people were reporting worse sleep and increased insomnia symptoms. And these are the people that we would expect to be impacted, fairly directly, maybe the loss of a loved one, or having employment issues, incredible amounts of chronic stress, food insecure, housing issues, financial difficulties, certainly losing jobs, things of that nature, difficulty transitioning to home, maybe all of a sudden you had to work from home and didn't have the space to do it, loss of coping strategies, like I mentioned, you may not have some of the things that you enjoy doing, like going to the gym readily available to you, and loss of childcare. So that can certainly cause some issues. And sure enough, this is in what is in my opinion, or as far as I know, the largest international study, for sure, actually the largest study in all that has assessed sleep difficulties. It definitely bore out in this study. So this was the International Collaborative of Sleep, an international collaboration of sleep studies. I guess study is redundant there, but this was an international multi-center online survey of over 22,330 adults, and even in this study, it skewed heavily female, so almost over 65%, almost 2/3 of the sample was female. But they had 13 countries and 4 continents involved in this study, and they sure did show that there was higher rates of clinical sleep disturbance. So higher rates of insomnia symptoms and higher rates of insomnia disorder being reported during COVID-19 times in this massive sample. And this is nearly twice the prevalence rate. These prevalence rates during these early days of the pandemic, and I forget the exact dates, I think this kicked off in April or May of 2020. So well after us, but still, even during that time, these huge, doubling the prevalence rates of insomnia symptoms and insomnia disorder in this sample. There's also high rates of anxiety and high rates of depression, weren't quite double, but still significantly higher than the typical prevalence rates you see during this time. So this is a massive study reporting this, and they found that people in confinement, people living alone or with 5 or more people, so there's kind of a sweet spot where you want to live with 2 to 4 people. Those were the groups that were particularly at high risk for insomnia. So those are the real risk factors during the early days of the pandemic. Now, that being said, like I said, some people reported worse sleep, but there's also this, I had a lot of grad student friends. I had a lot of, postdoc friends that were just like living from home now. They didn't have as many meetings to attend to. They didn't have a bunch of stuff. All of a sudden schedules were free, and both social pressures were off as well as work pressures were off. So there were some individuals that were reporting better sleep, and it seemed that they were relatively, this group seemed to be relatively unaffected by devastation of COVID-19. They may be more adept at coping or more adept at avoiding unpleasant news related to the pandemic. Working from home could have been is certainly has shown to be a perk. We're seeing like a big push for work from home opportunities. So it's nice to not have the commute time. It's nice to have more flexibility in your schedules. Some people were financially secure and even benefited from, were financially benefited that they were able to keep their jobs during the pandemic and got stimulus support. And then some people had fared better with social isolation or were able to establish a quarantine so that they had like a kind of, maybe another couple that they were hanging out with on a regular basis. And some people may not have had children to chase around all day, which I just love this slide. I'm going to keep it in, but I got to say, some of our early results actually shows that parents actually had slightly higher positive affect through the pandemic. So for what it's worth, kids actually seem to be maybe slightly buffering as much as I could throw them under the bus sometimes, not literally, but they seem to have a buffering effect on mood potentially. So, but like that becomes the question, right? So this one giant study is reporting, yes, certainly we're seeing these clinical sleep disturbances come up. What about for these people in which just kind of average citizens, how is their sleep being impacted? And so this was a study on our data set led by my colleague, Ryan Botari, in which it was just a subsample because this particular study was looking at a particular measure that was in one of the one-time assessments, the Munich Chronotype questionnaire. And what we did in this questionnaire is we asked them to think back before the pandemic and then during the early days of the pandemic and tell us what was their normal sleep schedule like. What time were they going to bed? What time were they waking up? Things of that nature. And what we were looking for were things like social jet lag and social sleep restriction. And so the best example of this is in college kids, where college kids might be, college kids probably still only going to bed at 1 in the morning. Let's say midnight for argument's sake, doing homework throughout the week. But then the weekend comes and maybe they'll stay up till 4 in the morning going to the bars under normal circumstances. And so they do that Friday and Saturday, and then they're back on Sunday night trying to go to bed at midnight. And every time they do that, it's basically like flying to from Boston to San Francisco and back every single week when you are selectively doing it. So they call it social jet lag because you basically have the same effects as actually flying across the country and doing that to yourself. You also might see kids that are, sleeping, and it can kind of go either way for college kids, but maybe they're sleeping 8 hours during the week, but then only 4 hours on the weekends or something like that. And that's where you might see something called social sleep restriction, where their timing of sleep is changing dramatically based on their work days versus free days. And so that was what we were looking at in this initial analysis. And that is basically what we found is, sure enough, there was an improvement. It's really hard to see it on this slide, so I'll describe it in more detail on the next slide. But what we saw is that sleep timing and sleep duration both became more consistent between people's work days and free days. So there was less that consistency, and that's why I asked about sleep consistency so much on those earlier slides, because we want to know how people's consistency doing, and people's timing and amount of sleep actually became better during the early days of the pandemic compared to pre-pandemic, on average in our sample. And so what does that actually mean? So there was a decrease in social jet lag and a decrease in social sleep restriction with the onset of the pandemic, which means that there was an increased consistency in sleep schedule. And so this is what it actually amounts to. So when we look at averages here, so you have the pre-pandemic and post-pandemic onset here. And on a day-to-day basis, on average, our participants were going to bed about 10:49 on a work day and 11:30 on a free day, for about a 40-minute difference. Whereas after the pandemic started, they were going to bed at about 11:15, so everything moved later. And this is a very common theme too, is that without maybe commuting, without whatever, people would tend to stay up later and also get up later, as I'll talk about in a second. But all of a sudden, this difference between workday and free day bedtimes shrunk to about less than 20 minutes. What is that? No, I'm sorry, 28 minutes. So there is a decrease in the difference that people are doing to themselves once the pandemic set in. People are more consistent on their work days and their free days. And then as far as rise time goes, this is where you really can see the big difference. On work day, they were getting up before 7 a.m. on average and getting up at about 8:15 on a free day on average. people were sleeping in an additional almost 35 minutes once the pandemic set in, and their 3-day sleep time only went 6 minutes later. So you can just see the difference between here is less than an hour, whereas the difference between these is about an hour and a half. And so you could see that the people's sleep schedules are just becoming much more consistent on a week-to-week basis once the pandemic set in. And that is healthy. That is what we as sleep scientists and sleep clinicians want to see is more consistent sleep schedule. Now, when it comes to duration, it's really interesting. We see not a lot of change. And this is bore out in my daily survey study. This is bore out in other people's studies. But we're seeing that there is an increase in sleep, but it's by a matter of 5 to 15 minutes. So on this measure, we saw a significant, because the sample was so big, 5-minute increase after the pandemic started. So people were getting a little bit more sleep, and hey, 5 minutes, not gonna argue with it. And in general, we saw that the effects were greatest in those with evening chronotypes, and were similar when ran for both US and non-US residents. So young people and people that tend to stay up later on average, evening chronotypes, they had the biggest benefit to this more consistent sleep schedule, essentially. And then this was just taking a look at some of the measures that we've collected during these one-time assessments. An 8 is a cutoff for even mild. Like we would say this is any under an 8 is no significant insomnia symptoms whatsoever on this insomnia severity index. So you can see that our group did from June to September and February did have a decrease, but it never really got that high in our data set is the kind of point here. Same goes for this measure called the Pittsburgh Sleep Quality Index and this report on sleep quality here. In general, during this at least May to February period, May 2020 to February 2021, there was some improvement, but things just never even really looked that bad on average in our sample, which was surprising. So it seems like in our sample, if anything, sleep largely appeared to improve on average. And again, I just want to stress this, not everybody. We have the ICOS study that saw that the clinical sleep numbers were going up, but even despite that, on average, our average citizen number, average sleep timing numbers seem to show this improvement. And I think that this is an opportunity for us as scientists and clinicians to talk about the detrimental impact of normal society on sleep. We're constantly trying to burn it from both ends. All of a sudden we've gone to not having to commute, not having morning meeting times to back to the grind. And what is that doing to our sleep and impairing our sleep? And I think we're going to start to see that in some of our data that has been collected more recently. I think we'll see a return to worsening sleep habits as the world kind of began to open back up more. And I think that this really is an opportunity for us that we should take and should mention. And real quickly, I just want to show that we're not the only ones finding this. This was in a study that used Fitbit data from 6 major cities. And you can see here, this is the green is 2018, 2019, overlap very nicely. But for the first 3 months, so starting in March, all of a sudden sleep duration started to slowly climb in these individuals. So during the early days of the pandemic, and again, not huge, but by about 10 minutes, right? On average, sleep is starting to climb based on this Fitbit data. And same study, we're looking at bedtime variability. So how much did it vary between persons? And we did see a pretty massive, a 6-minute drop, but again, a significant 6-minute drop, with the onset of the pandemic. And so again, just showing that in this other data set, they're also showing similar effects here. And this is another study that used smartphone data. Again, these scales can kind of make this look huge, but this is, about a 12-minute increase. So on average, compared to 2019, using this smartphone data, they saw, a significant 12-minute increase from comparing once the lockdowns hit in mid-March through April. So again, it's not just us. It's not, a lot of these bigger scale kind of average studies are actually showing improvements that came once the world kind of came to a halt. And even that major study I talked about, the ICOS study, they showed that those the significant effects of the clinical levels of insomnia symptoms also decreased pretty rapidly with time. So this is weeks since the pandemic, so it's weeks since March 1st, 2020. And by week 13, they were still pretty high, and then they just really decreased precipitously through the end of the study and kind of flatlined there. So back to more normal levels. So clearly, had they waited another week or two to launch their study, it wouldn't have looked nearly as severe as it was based on where they started. And so again, just thinking about the context, the longer they waited to get started, people are going to be improving pretty quickly. So the quick summary here is sleep during COVID-19. On average, across the entire population, there has been a strong improvement in sleep regularity, a delay in sleep timing, and to some extent, a general increase in sleep duration. But again, I just want to stress that's not the case for everybody. Individual differences in circumstances may put people at more or less risk, so things like job security, healthcare workers, as Raquel mentioned at the beginning. Like none of the studies I mentioned specifically targeted them, and you're seeing way worse symptoms in healthcare groups, shift workers, essential workers. Age is a big factor, and other things like previous physical and mental health and caretaking. Also, it's going to be important to take timing of assessment, location, timeline of the spread of the disease in the area, and other societal factors into consideration when you analyze this data, especially on an international level. And some important considerations moving forward are finding groups that are particularly at risk and determine interventions prior to the next pandemic, should something like this happen again. And then again, like I said, I am very interested in how we can preserve some of the things that showed improvements during the early days of the pandemic. It shouldn't be that society is stripping us of our sleep and making us burn it from both ends. So again, I think pointing that out is going to be really important. All right, I'm going to try to go through these next slides pretty quickly because I do want to talk a little bit about improving sleep. But we did get some good results. This is our most recent study that just got accepted, looking at daily things like depression, affect, mental health measures, and things like that. So how did that change during the time, during the early courses of the pandemic? And so we came up with this breakdown of the data that we had collected from March 20th through April 20th, 2021. So about this first year of data collection. And we found ways to bin the data. And we did think that there were some things going on that we had to take into account. So, this time bin in particular, this was around the time of George Floyd's death and the protests that were elicited in the wake of that. And so we wanted to definitely take that into consideration. And then also the US election. We collected data over the course of the 2020 US election, which was highly divisive. And so we specifically kind of set up our bins to take some of these other things that were going on into consideration. And the initial analysis here was done in the context of age effects on mood, stress, and emotional well-being, because if you didn't know, age has been shown to be, just during normal times, age has been shown to be a huge buffer on mental health. And it's just being older age, you may have heard those rosy colored glasses. That is a real effect that people see. The older age is tied to better mental health just across the board, typically. So we were interested is this going to hold up during a pandemic in which these older adults are specifically targeted? And that was kind of what we were really interested in. And the short answer is yes. So right here in each one of these, they have a model estimate. So if I, based on our data set, if you took an average 65-year-old and an average 25-year-old and compared them, that's what's graphed here. And so older adults in general showed higher positive affect, lower negative affect, lower depression, lower stress, and initially lower worry about things related to the pandemic than the younger adults. The only thing that they were worse on was worry about their individual health. So older adults did have significantly higher worry about their individual health. This certainly makes sense during the context of the pandemic. But during the initial days, there was an interaction so that older adults worried less initially, but eventually those two groups met up and there was no difference in social isolation. But the main point here is that most symptoms improved pretty dramatically over time. So even with our March 20th starting as early as we did, we really didn't catch much of a spike in symptoms. It basically started decreasing from there. So when you think about all these other studies that have come out and published data based on data they collected in May or June, or it's really important to look at the dates that the data was collected and see what was going on. Because based on our data here, across the board, there was a main effective time so that all of these things basically from point one from the start to finish just improved over time. And you could see a couple of spikes here. One of them is T4. This is what overlapped with George Floyd's death as we anticipated. And this huge spike in negative affect and stress here is the US 2020 election. So again, there were other things going on last year too that people are doing this COVID study and just forgetting the context of the rest of the world. I think it's really important to take all those things into account. So we did see these spikes, but even despite them, there was still a general trend for improvement over time in almost all of our measures. So yeah, you see that even despite like these increasing numbers, all of these things the trend was decreasing over time. It's really interesting. And this is just to show that basically the same thing held true for the most part, based on residents, whether people were from the US or not from the US. But there was some different, there were a few places in which there was a main effect of residents on positive affects. So non-US participants had better positive affects. And there were a few things in which there was a residence by time interaction, which just means that whether you were in the US or not in the US, it kind of changed the shape of how your improvement happened over time. So there was still, in general, for both groups, there was still a main effect of time. People were still improving, but it's important to take in context where people are coming from and what probably means the onset of the pandemic during those times in order to fully understand what was going, how their improvement kind of happened over time. Let's skip this slide. This is again just showing that some of our one-time assessment measures show the exact same thing. So across our sample, participants' mood and affect largely improved from the launch of the study. Again, not the case for everyone. Older age continued to be a beneficial moderating factor, even despite living through a pandemic that specifically targeted them on everything except worry about their individual health and social isolation. Their older age still continued to be a buffer. There were some main effects and interactions with residents, so location is an important factor. And so again, there's not much, so the same, again, I think it's important to find risks that are at group, younger adults being one of them. I'm sorry, groups that are at risk, younger adults being one of them, and think about interventions prior to the next pandemic. And then when you're looking at research about this pandemic, about the current pandemic, it's important to keep in mind that quick resiliency that our data is showing, and also that COVID-19 did not occur in isolation. There were other things going on. And so really this is just the start to our data set. These are all the papers that have been accepted for publication so far based on our data set, but we have a lot more coming and there's a lot more data to do. All right, so how can we improve sleep and mental health even during a pandemic? Here's the secret. The advice doesn't change. I think the biggest hurdle during a pandemic is the coping mechanisms that people typically have may no longer be available. So if you had one of your best coping mechanisms was going to your mom's house and your elderly mom's house and venting to her for an hour every Thursday night, that was no longer available. That was what I think really needed to find replacement. The sleep advice doesn't change. One that often gets overlooked, that's why I gave its own slide, is the importance of light. And I could go over a whole lecture about light, circadian rhythms, kind of keeping you regular. When we talked about that sleep continuity, consistency, that is what we're shooting for, and light is going to help you do that. So one of the things that for people that were having some difficulties, the first thing I talked to them about was getting light exposure, particularly during first thing in the morning. So I was fortunate to be able to walk my dog first thing in the morning, and that helps me kind of get that exposure to light first thing. But even if you're working from home, you obviously want to avoid the screens at night. Everybody kind of knows that, but working from an office, like creating a home office that's near a window, huge benefit. And this can even go for when people return to the office or as they return to the office. If you can get some light, particularly during the early morning hours, it's hugely beneficial to your sleep and keeping you on a regular sleep schedule. And then avoiding screens at night is helpful, obviously, for two reasons. It helps you for avoiding that blue light. It actually does. It impacts your sleep and it changes your circadian rhythm and things of that nature. But then also it has the added benefit, if you're avoiding your screen, you're less likely to be taking in negative news and things of that nature right before bed. And so a curfew for electronics is definitely something that I would recommend. Some other things, I call it sleep hygiene, just as this like sleep hygiene, just as like a general name for it. Some of these things are that sleep hygiene has issues with. I'm getting in the weeds as me as a sleep person, but the fact of the matter is it holds true. The first things first was to normalize some level of acute sleep disturbance, because one of the things that can really trigger insomnia is people start panicking that they're not getting enough sleep. So they'll lay in bed for 15 minutes and then they start getting more and more stressed that they're not falling asleep easily. Believe me, throughout the course of this, I've had many nights in which I've had difficulty falling asleep. And as a sleep scientist, the best thing I can do is just tell myself, like, I'll probably sleep really good tomorrow night. And so just not to let that spiral out of control of you and start taking over your cognitive processing. And so if you can manage expectations and just everyone has, like, there's not a person, I will go out on a limb and say there's not a person who's walked this earth that has not had a couple of nights of acute insomnia. And so if you can kind of just help them manage that and manage their expectations, that can really go a long way. But if they find themselves laying in bed for 30, 40, 50, 60, 90 minutes straight without, and just getting more and more frustrated, to get out of bed, reset, and this happens both at the beginning of the night or in the middle of the night. If they find that there's no good that comes from just staring at the ceiling and getting more and more stressed, just get out of bed, do something relaxing, still try to avoid light and screens and things of that nature. But just try to reset, maybe try sleeping in a different place. That works for some people. And there is like individual differences in what can be helpful for some people, but certainly staring at the ceiling, stressing, or staring at your clock, doing the math of like, if I fall asleep now, I'll still get at least 4 hours of sleep, not going to be helpful. Physical activity and diet, again, very helpful for sleep. You don't want any heavy meals and you don't want to work out too close to sleep, but otherwise they can be really helpful. A hot shower about 90 minutes before bed is really good, and that actually helps start this cycle of cooling down your core body temperature by taking a hot shower before bed. So if you do that before bed, it'll obviously start to draw out the heat from your central areas, and that'll help kind of with this dip in your body temperature that occurs naturally throughout the course of the night. Avoid caffeine after noon. This is my favorite kind of tidbit, is that caffeine on average has a half-life of 6 hours. So if you drink that mocha frappuccino at 6 p.m., half of that caffeine is still going to be in your system at midnight. You drink it at noon, a quarter of that caffeine is still going to be in your system at midnight. So, Starbucks and Dunkin', they have it down right. They look at when their specials are occurring, things like that. So you have a bad night of sleep, and what do you do the next morning when you are really tired? You go and get more coffee. So, being smart about caffeine consumption is really important. If you can keep it before noon, I highly recommend it. Avoid too much alcohol. Alcohol is a sleep fragmenter. It's a depressant, so it might help people fall asleep in their minds. It might be like a crutch for that, but it just fragments your sleep. It dehydrates your brain. Your sleep is not going to be of the quality that you want, for sure. Nap responsibly. I could give a whole lecture about this, but basically no later than, I'd say 3 p.m. is the absolute latest to be waking up from a nap, and you're going to want to sleep either less than 20 minutes or about 90 minutes. If you sleep anywhere in between that, you're going to get into the really deep stages of sleep, so you're going to wake up feeling even groggier than when you went to bed. And so napping can be an effective tool, especially for older adults, and especially for people that nap regularly. But what you don't want to do is nap so close to your bedtime that you then struggle to fall asleep that night. That's what you're really concerned about. And then things like relaxation, meditation, mindfulness, all great, highly recommended. If these aren't working for you, this would be the time to reach out for CBTI treatment, cognitive behavioral therapy for insomnia. And then one thing I always like to point out is that, as with any CBT treatment, you may need to make adjustments for any given population. And there are directories hosted by the Society of Behavioral Medicine and University of Pennsylvania that can help you find providers. And then medicate as needed, and that includes melatonin. Like, I would really, personally, I try to hold off melatonin to last resort, even after CBTI, if they can get into a program for it, because that is, people don't take it right. They think it's a huge bolus right before they go to sleep, and really should take a much smaller dose, a couple hours before sleep. But again, CBTI is what works. And during a pandemic, the recommendations unchanged. This is the result of a study that I was a interventionist on. So this is just change in the insomnia severity index compared to our control group in our intervention. intervention arm, and it was hugely effective. And it was a small group, just 10 and I think it was 20 in each arm, and we still had a massive, like a significant and clinically significant change in insomnia symptoms delivered via Zoom. And so CBTI still works, and it's great. And I think post-pandemic, we need to start taking into consideration, like I said, how does society and how do our schedules and obligations impact our sleep? And so that'll probably be something that I work more into CBTI treatment that I do in the future. So that is something that you guys could talk about now, think about now for yourselves, or talk about with your family or patients, is how, as things return to normal, how is their sleep being impacted potentially in a negative direction? So it's just something to keep in mind. So thank you. I'll take questions now. I know that was I'm happy to stay a couple minutes late. Again, free data for those that want it. Thank you to my collaborators, Elizabeth, Eric, and Ryan on just at least this portion of data at the end of the day. Feel free to contact me via email or Twitter. And thank you for having me. I'm sorry for the snafu on the earlier slides, the poll over.
Tony, thank you so much for another wonderfully informative, helpful, and engaging presentation into such important work that you're doing, and really look forward to part 3 at some point in the future when you get more findings in. But like you said, we'd like to open it up now for any questions, comments, or ideas anyone has in the next few minutes. Feel free to either use chat, or you can unmute yourselves to ask the questions as well.
I just see a question from Carla Dawson in the chat. Do I use motivational interviewing with clients? Absolutely. I mean, I think the biggest thing for, I didn't give CBTI, maybe, I don't know if you guys have had a CBTI talk in the past. I could probably do that specifically sometime if that would be appropriate. But the biggest thing about cognitive behavioral therapy for insomnia is actually, it's very counterintuitive. And because what you have is you have people that spend 10 to 12 hours in bed trying to get 8 hours of sleep. And it's very ineffective to do that. And so what we actually do is something that used to be called sleep restriction. It's being rebranded to efficient sleep, because people because again, for the exact reason that you mentioned, patients don't think that that's a good idea on the face value. And so the very first session, and really throughout it all, you have to sell them on the idea to spend less time in bed. And so if a person is spending 10 to 12 hours in bed and only sleeping for 6 of them, the first thing we do, and one of the most effective things we do, is for a couple of weeks only let them spend 6 hours in bed per night. And then you know what we do is we try to take out all of that awakening and actually just have them sleep or spend the time in bed that they are getting sleep. And then, because one of the big secrets is you don't actually see a lot when insomnia improves, I'll put it that way, you don't see them getting a lot more sleep. It's just that they're spending a lot less time awake in bed, which is like the big problem with insomnia. And so you might eventually, for some of the really severe cases, you might eventually start to increase that and see an increase in sleep amount. But the big thing is sleep continuity, and you're really just trying to get them to sleep, to spend the actual time in bed that they need to sleep. And motivational interviewing is a huge part of that. And for all these things, any change, any behavioral change, motivational interviewing is going to be a huge part of that. So absolutely, I feel like my first session is a sales pitch. That is how I go in. The mindset I'm going in is I'm going to sell them on this idea, and it's easier because I have all the background in sleep, and so I can go off on tangents and all that stuff. But once you learn the basics of it, CBTI is not a rocket science program for sure. I think again, one lecture and you get the basics, and there's a weekend coursework, and you'd be well on your way to being a provider in that. And we're always it's just wildly underserved area for sure. Hope that answers your question. What is the best time to stop screen time so it doesn't affect sleep, especially for students? That is a great question. So there's this really interesting trend where those of you with teenagers probably know this already. Bedtime start moving later. And at least that's where they want to go to bed, right? The place where they want to go to bed goes later and later and later. And that is actually normal. There is actually this trend, and we talk about chronotype, and the trend is for people to become later and later, especially males, to get later and later. And then at some point, and some researchers actually have suggested that this marks the end of puberty. It then starts to get earlier again until older age, and then you're going to like the early bird specials at 4 p.m. for dinner. And so you see this with teenagers, where it gets later and later and later. And part of that there is circadian reasons for that. That doesn't mean that these teenage kids still don't need 9, 10 hours of sleep. And that's where the problem comes in, is because they're biologically being pushed later, but school start times are still 8 a.m., whether they want them to be or not in a lot of places, right? And so, the general rule of thumb is, probably 45 to 60 minutes before sleep, no screens. I think you can be more targeted in that. There are certain periods of the day in which light has its greatest effects, which I can't remember. I know in the morning, getting light around 6 a.m. on average for the average adult, I should say, is going to have the greatest effect in drawing your bedtime earlier, like what your circadian rhythm wants your bedtime to be. It draws it earlier if you get a light around 6, 7 a.m. In the evening, I think there's a little bit more variability on person-to-person level. But if you have kind of an established bedtime, I guess the rule of thumb would be, if you can do 45 to 60 minutes without screens in your face, I would highly recommend that. And I think you could even potentially get a little bit more targeted depending on like when your teenager might be wanting to go to bed and things like that. 1 hour before sleep, stop screen time would be my recommendation if you pull it off. That goes for us as adults too. I know I struggle with that for sure. I love it. So I'm scrolling through the comments, and thank you all for being good sports and putting in how your sleep went as comments. It's really interesting to see. To read through it. So.
Again, Tony, this was great. I'm also wondering, I know we're after 2 already, but maybe when we post the recording and slides later on, maybe we can even put in some notes about any resources, tools, that websites or apps that people might be able to access that can help us improve our sleep. Or even if somebody might be looking for CBTI providers. Where
I can include those
for that. And when you were mentioning things about the importance of sleep, that made me think of things like light therapy lamps and things along. So, if we can, include some notes on the website along with these resources, that would be wonderful.
Yeah, I think most of us are in the Northeast, and seasonal affective disorder is rampant with these, short days. So light therapy can actually be a very effective way of combating it. And like I said, I'm happy to post the links when we post the video. Since I went through this quickly, they have a couple directories hosted to places for current providers, but they're always looking for more. There's one more question I'm happy to answer really quick. We'll make it the last thing, I guess. Is there anywhere we can look at what type of sleep time we should be getting at, such as older in life as well? It really varies, and the way we recommend it is like the way you find out, honestly, like what is your preferred timing and amount of sleep is to find. It's just really tough to do. It's find 2 weeks in your schedule that you can sleep as much as you want, right? And you're gonna close off all of the blinds. You're gonna get all clocks out of the room, no alarms, and you're gonna go to bed at about the same time every night and see what time you wake up. And you got kind of like gauge, because again, you don't have a clock in the room. How long does it take you to fall asleep, and what time do you wake up? And once you start waking up on a consistent basis, and older adults probably happen quicker. I'm usually talking to college kids when I say they need the full 2 weeks to make up for all the sleep debt that they've built up. But once you start waking up at the same time without an alarm, that is about how much sleep you as a person need. And I think most of us intuitively know at this point, once you mid 30s and higher, you've burned it enough to know, okay, I'm not really a 5.5 hour person, right? I'm a 7 hour person. And so you're probably right on that. The big thing is that sleep amount is a really interesting question because older adults do get less sleep, but then the question becomes, do older adults get less sleep or do they need less sleep? And that is an open question in the field. So, it's really interesting. There's changes, there's metabolic changes, there's brain changes, there's depth of sleep changes that happen throughout the course of your life. And again, I don't probably have, I don't have the time to go into all those details, but certainly, like, I think once you get a good sense for when you can go to bed and fall asleep within 10 to 15 minutes, and you're able to get up at about the same time every day, that is going to be what you're looking for. And it really comes down to personal preference. And if you haven't gotten a chance to like figure that out, even later in life, because obviously there's, people are all sorts of situations. We're still living through a pandemic. Then the best thing I would say is to just try to commit a couple of weeks to really being consistent and see how that goes for you. And you'll probably learn a lot about yourself. And getting a sleep tracker or things of that nature. I don't normally like, you can actually, they're not the best, like even Fitbits and things like that aren't the best, but they're pretty good at judging sleep start time, sleep end time, and sleep amount. And so you can learn a lot about yourself doing that. And if you're able to be consistent for a regular time, you'll probably learn a lot about yourself too. But there is a lot of variability. And so it's tough to pigeonhole anybody. It's like, oh, you should be going to bed earlier or later. That one of my bosses in the sleep field is still like a 3 a.m. night owl in his late 60s, early 70s. So it's different. He just knows that's his preference. So thank you all for having me. This was great. I'm always happy to come talk to you guys about this.
Yes, well, thank you again, Tony. And I know, Courtney, you have a few closing remarks before we shut down for the day.
Thanks so much for such a wonderful presentation, Tony. And thank you everyone for joining us today. You'll be receiving an evaluation form via email right afterwards, so please fill that out. And we have some upcoming events posted on the MHTTC website. So please feel free to check them out and register if you're interested. Thanks again, everyone.
Thanks, everybody.